So this is a continuation of this case study of the first rib being inferior on the left side. So after I restored that mobility, then I went on to retest the clavicle. And he has good inferior spring of the lateral clavicle. Okay, it's equal on both sides. And then I test posterior spring. All right, and that mobility is good. And then I test lateral spring. And I test lateral spring here, and it's interesting, but he doesn't have any lateral spring. Now when I test medial spring, that feels excessive in comparison to this side. This side feels stronger. Comes to a stop point. I can spring it, it recoils, but I come to that stop point sooner than when I do medial, inframedial glide on this side. Okay? What's interesting is that his acromion does spring laterally. So I'm springing the acromion that way. Okay? Because I can spring the acromion, I don't believe that the clavicle has migrated medially and needs to be mobilized laterally, even though it lacks lateral spring. What I think is happening is that this is a rare sternoclavicular joint movement impairment. These are really rare. Many times it looks like the joint is involved, but when you free up AC joint mobility, then this is normalized. But in this example, I find that his clavicle is elevated medially, and I'm sure the camera angle can see that. It's distinct. It's, 3/8 of an inch difference. Okay? And then when I come on front of the clavicle, this clavicle is deeper in relationship to this one. So let's take that wrinkle out of his shirt, and if we slide across, you can see that my right thumb would override by about 1/4 of an inch. So, cannot spring the left medial clavicle inferiorly, and I can spring the right one posteriorly, and I cannot spring the left one posteriorly. So what I'm going to do is and we know from the biomechanical literature, we know that the clavicle rotates. Okay, it does several things, but that's one of the things that it does. So I'm calling this a rotational problem in which the clavicle is rotated superiorly. Okay, so what I'm going to do is try to isolate that joint. And this could be controlled by muscle. It could be a nervous system function. Could be a passive slight displacement. Nobody knows. Nobody can prove it. I'm not going to argue on the internet with all these experts. I'm more interested in treating this patient because this patient has a unique pain presentation. And we have imaging information that we know that these joints got injured with that 11 millimeter osteophyte. So what I've done is I've taken the humerus in the same angle as the clavicle. And then what I'm going to do is internally rotate his arm. I wish I had 3 arms. But I want to feel with my hand and see when I isolate forces there. And it's right now. Right now I can feel a little bit of movement in the sternoclavicular joint. So I'm going to take my other hand and just push through his shoulder and push him into internal rotation. He's at an end range, and so I'm going to oscillate this 30 times. Well, I've certainly gained range of motion of shoulder internal rotation in that context. So let's see if anything changed. It's no longer elevated. I can now spring it inferiorly towards his belly. Okay. Coming on top, they are much more symmetrical. I'm springing it posteriorly and it has movement. Okay. And it seemed to have excessive medial glide. And that seems less now. I can spring it and it recoils. And he did not have lateral glide. And he now has lateral glide mobility. So I think that my theory was correct, that it was involving the sternoclavicular joint, and that treating it normalized muscle tone and normalized movement through that joint. So, does it feel any different when I spring on this?
No.
No. Okay. Do you have a way of testing it?
No.
Did you have any discomfort when I moved it this way?
No, it seems to be okay now. I mean, it doesn't seem to hurt.
Okay. Can you test it with shoulder motion?
I might be able to do it with this. There's no pain anymore.
Uh-huh.
No, I think it's repaired because it doesn't give me any pain.
Okay. Alrighty. Well, I'll take it. Very good. Interesting case. Glad we could film this and post it. I like posting interesting cases. Thanks very much.